Hello everyone, my name is Arvind Gill, and today I will be presenting my DNP scholarly project titled Nursing-Led Therapeutic Group. This project was conducted in a state correctional facility located on the west coast of United States. So first, my committee members. Dr. Michael Graham is my DNP chair. My second reader is the 707 instructor, Dr. Maria Snell, and Kiran Handel is the community member. My PICO question was, in a correctional institution with a patient population with various medical and mental health levels of care, does integrating the nurse-led therapeutic groups as compared to current practice decrease the 7362, which are the sick call forms submitted by patients, and increase patient knowledge? So now let's talk about the background and significance. The overarching aim of this project was to improve the overall health and wellness of this population and reduce the number of sick calls at the facility. To address this issue, a quality improvement project was proposed to launch at a correctional facility located in the western region of the United States. NLTG program was implemented with an aim to increase patient knowledge and decrease sick call submissions, or the 7362 forms. The importance of patient education initiatives for improving compliance is widely acknowledged. Currently, there are 1.9 million individuals residing in correctional facilities within the United States. The education provided by nurses is crucial for increasing individuals' understanding, comprehension, and readiness for self-management. Berg et al. Mentioned that despite being a crucial component of nursing care and being emphasized in recommendations for nursing practices, several shortcomings are found in provision of patient education. And one of those shortcomings is the lack of standardized curriculum. Higher morbidity and low compliance with treatment are prevalent among the residents of the correctional system facility. Patient education within correctional system could help to increase compliance, patient knowledge, and better healthcare outcomes. Now, the review of literature. CIA, NHL, and Medline are the two databases. Search for their related scholarly articles for this project. The authors selected and the articles published over the last 5 years, but only included 2 articles published over the last 8 years due to their relevance to the project. The studies reviewed has 4 common themes. First, incarcerated population, healthcare outcome, patient education, and patient knowledge. So let's talk about incarcerated population first. The global prison population is growing faster than the population growth rate. And currently, approximately 2 million people are incarcerated in United States alone, as I mentioned during the previous slide. In addition, incarcerated individuals are at a greater risk of various health-related conditions than the general population in the community. The NCC, the National Correctional Care Healthcare entity, that's a nationally recognized entity and provides standards of care within the correctional system, advocates for quality healthcare services in a correctional setting that enhance patient outcomes. Epidemiological data presented by various studies continue to suggest that the overall health of incarcerated populations remain poor. Second theme is patient education. Patient education improves healthcare outcomes and helps to improve the national health-related policies. Studies conducted that health education improves the subject's knowledge and emphasized on the importance of patient education. and provides its critical nexus to quality patient care. Patient education is an integral part of the patient centered care approach, as well as definitely should be considered a core component of healthcare. Patient education supported that it helps to increase patient knowledge on various health diseases and processes and could lead to higher compliance rate. Healthcare outcomes. Again, most of the articles selected promoted increased healthcare outcomes due to patient education provided by the healthcare staff. Many scholarly articles, those are included in this project, as well as NCCHC, supported the idea that targeted patient education aims to increase healthcare outcomes and related behaviors. Many other scholarly articles also included in the study advocated that better patient outcomes are a direct result of quality patient education. Patient education on disease processes prevention is crucial for optimal healthcare outcomes also. And the last theme is the patient knowledge. Many studies support increased patient knowledge as a direct result of patient education. Study shows that new strategies should be developed to enhance patient education efforts as it directly improves patient knowledge. Furthermore, patient education is even more important for incarcerated individuals for a reason because they have limited resources to increase their knowledge related to health and healthcare conditions due to many factors such as limited internet access, limited access to any sort of healthcare magazines. Therefore, the nurses play a crucial role to bridge that gap, and it helps to increase the patient's ability to self-care, leads to increased self-efficacy. Many studies have advocated that timely patient education provided by nurses is a key to building patient knowledge. Next is the theoretical framework for this project, and I selected the health belief model because health belief model theorizes that a person's perception of a health problem's threat and the perceived value of the action that will reduce the threat will influence health-seeking behavior. And here is the components of the health belief model: perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cue to action, and self-efficacy. The health belief model emphasizes that education and messages will help create optimal health behavior change only if the benefits of the education, possible barriers, and self-efficacy are factored into the equation. Now let's talk about how this theory fits into this project. The NLTG is a voluntary patient education program covering various categories of topics such as physical health and wellness, mental health and wellness, substance use, life skills, transitional planning, expressive group, and community meetings. Patients sign up for these programs based on their identified need, either as preventative measure or existing health conditions, which is perceived susceptibility and severity. Once the patient attends NLTGs, the patient weighs in the potential positive outcome for adapting the education provided and would consider potential barriers to the adapting positive actions learned during the NLTG. That's the perceived benefits and barriers. The ultimate goal of NLTG is to improve the health and self-efficacy in patients, and self-efficacy is a cognitive process where environmental and social influence helps individuals adapt and learn new behaviors. Now, the method and design of the study. The project was designed as a quasi-experimental pre-post design following a quantitative approach. The project evaluated the increase in patient knowledge based on patient responses on the voluntary surveys. It also compared the difference in the number of sick calls submitted by patients before and after intervention. During this research, no patient information was abstracted from any patient's electronic charts, and no patient identifying data was collected. For the setting, as mentioned, this research project was completed at a correctional facility. And for sampling, I chose to have a convenience sample for the patient surveys. A total 52 surveys were collected. And for the sick call submission, the 30-day pre-post intervention, 174 sick calls submitted prior to the NLTG implementation, and 149 submitted 30 days post-implementation of NLTG. Inclusion criteria. The inclusion criteria for the participants that they have to be incarcerated in a state correctional facility during the project timeframe of the implementation. They have to be adult male over the age of 18. They have to voluntarily sign up to participate in NLTGs and complete the post-NLTG patient survey, which was also voluntary. Exclusion criteria. The exclusion criteria for participants was incarcerated individuals over the age of 18 who did not sign up for NLTG, and participants who attended the NLTG but did not complete the post-NLTG patient survey. Next, here is the data sheet that I utilized to collate the patient survey responses. It recorded how many patients responded yes or no to the patient knowledge increase after attending the NLTG. The question on the survey that was given post NLTG classes was, does the NLTG help to increase your knowledge on the topic that you attended the NLTG on? And it was a yes and no question, and 48 patients out of 52 responded yes, and 7 responded with a no answer. And here is the data collected for the sick call submission. The existing quality management report was utilized to get the number of sick calls submitted 1 month pre and post NLTG program. During the time of the project time frame, the total population at institution was 3,845. 174 sick calls were submitted 1 month prior to NLTG implementation, and 149 1 month post NLTG implementation. Here's the data analysis. Statistical test upper tail z-test for one proportion was used for patient knowledge. Data analysis utilizing this one proportion z-test showed a positive correlation between NLTGs and increase in patient knowledge. The achieved power of the study was 1.000, which is considered strong. The z-test for difference of two proportions yielded a p-value of 0.4 for the number of sick calls submitted pre and post intervention. The results showed a positive correlation between NLTG and patient knowledge increase. However, the results showed a lack of correlation between NLTGs and a decrease in sick call submission. So here are the results of patient survey. Out of total 52, 48 in blue responded yes, and 4 in red responded no to the patient knowledge increase question on the voluntary survey. And here is the data in a bar graph for the sick call submission, form submission. Total 174 submitted prior to the NLTG, and 149 submitted 30 days post NLTG implementation. Next, let's talk about the limitation. Limitations for this project was human error. The project was limited to single clinical site, larger cohort, and the limited time frame due to program deadlines. Barriers. The study is carried out in a correctional facility, and actions are strictly monitored and observed in a self-contained environment, so which leaves little possibility for flexibility or adjustment. The NLTG intervention is categorized under the Rehabilitation Achievement Credit Program. Since there was already other educational programs under the RAC, which is the Rehabilitation Achievement Credit Program, the RAC program, it facilitated an uncomplicated implementation of NLTG program. The enrollment process was already framed for the RAC activities, and the same process was adopted for the NLTGs. Another facilitator for this research was the NLTG curriculum. The organization already had an existing library with over 200 36 NLTG groups categorized into 7 different subcategories. The NLTG library was a huge benefit for the research project, as soon as the training for the nurse facilitators was completed at the research site, the site was able to utilize the available NLTG material to implement the program. The mission of NLTG program is to improve inmate patient health knowledge of their diseases, disorders, learn and improve upon self-management methods, encourage active participation in their disease management and prevention programs. And another huge benefit to patient was that program allowed them to participate in NLTG activities that provided education on disease processes, substance use disorders, positive health behaviors, and health improvement, therapeutic interventions, and improve the patient's overall quality of life. Lastly, the site manager was supportive of the project and valued the benefits of the program to the patient, nursing staff, and organization. This allowed the seamless implementation of the project with minimal delays. Next, we're going to talk about the discussion section of this project. The researcher evaluated the impact of NLTGs on the patient knowledge and submission of sick call slips within a correctional facility in the United States in the Western region. Data interpretation indicates a clear correlation between attending NLTGs and increase in patient knowledge, as demonstrated earlier in the previous slide with the use of the Z-test. The researcher expected an increase in knowledge after attending the NLTGs. The researcher also expected a decrease in sick call submission by the patients. However, the data analysis could not establish any relationship between attending the NLTGs and sick call submission. To establish a relationship between NLTGs and sick call submission, the researcher recommends collecting data in a larger group over extended period of time, as well as collecting the data on multiple clinical sites within the organization's correctional facilities. The author also recommends that implementing a patient population need-based education program could help increase patients' knowledge and lead to positive healthcare outcomes. Now we will talk about the implication of this research for practice. Firstly, the implication to the future research. The study highlights the importance of patient education to enhance patient empowerment. NLTGs provided information on various disease processes, common medication side effects, complication of substance use, and other positive health behaviors. It helps to promote positive health behavior that contribute to better patient healthcare outcomes. NLTGs provided information regarding physical and mental health and wellness, substance use disorders, transitional planning, community meetings, expressive groups, and life skills. Patient education is an integral part of nursing responsibility, especially in corrections, where the patients have limited access to information regarding health-related topics. Next is the implication to healthcare policy. The healthcare sector has made numerous attempts to focus more on patient, mainly through its quest for increased patient participation. However, providers must comprehend patient education to increase patient engagement. Providers can adopt patient education initiatives to better educate their patients about their health and wellness, the care management techniques required to achieve that health and wellness, and the industry best practices for navigating the healthcare system. And lastly, the implications for practice, for the advanced practice. Patient education is an integral to providing care to patients as a healthcare provider, and it helps to solidify the information that patients need to stay compliant with their treatment. The knowledge increase will lead to positive health behaviors and leading to positive healthcare outcomes. Now let's talk about the conclusion. A total of 54 patient surveys were collected for evaluating the impact of NLTGs on patient knowledge for this research project. The sample size was sufficient for the nature of the inquiry for the study. However, a large sample size was the potential to generate results with a higher generalizability. The study was conducted only at one correctional facility within the state's correctional healthcare system. Inclusion of residents with multiple correctional sites would render stronger results. Patient surveys with close-ended questions were utilized to collect data on the patient's knowledge after attending NLTGs. There are several inherent issues with the use of surveys to collect data. One of those issues is related to lower validity rate with close-ended questions. In addition, time constraint was another limitation for the study. The author has to complete data collection within the set week based on the program deadline. The NLTG has shown to increase patient knowledge based on data analysis. A key aspect of health treatment is patient education. It is a recognized predictor of enhanced medication and treatment adherence, increased collaborative decision making, higher levels of satisfaction, and even better treatment outcomes. The author recommends that implementing a patient population's need-based education program could help increase patients' knowledge and lead to positive healthcare outcomes. So here are my references, and thank you all for watching this presentation.